experience and membership that backs what you're building with American Express Business Platinum. Get 2 times membership rewards points per dollar on eligible purchases in key business categories, as well as on each eligible purchase of $5,000 or more, on up to $2 million in eligible purchases per calendar year. American Express Business Platinum. There's nothing like it. Terms apply. Learn more at americanexpress.com/business-platinum.
This episode is brought to you by CeraVe Hair Care. Scalp is skin. Healthy scalp, beautiful hair. Discover hair care reinvented with dermatologists from the #1 dermatologist-recommended skincare brand. With gentle, hydrating, and oil control balancing shampoo and conditioner. Formulated without sulfates or fragrance, CeraVe Hair Care is suitable for sensitive scalps and all hair types, curl patterns, and color-treated hair. Visit CeraVe.com/haircare to learn more. Available online and in-store at retailers nationwide.
Hey everyone, Chris here from MedPrep to Go, and welcome to another episode of our USMLE Step 2 Questions podcast. I'll be your reader for today, and in this episode, I'll be going over 3 Hem-Onc questions from our online Qbank. As always, you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Hem-Onc 4. A 38-year-old man presents to the emergency department with a complaint of dark urine, weakness, and back pain for 2 days. Prior to onset of symptoms, the patient was seen by his primary care physician for a rash with associated sensory loss. He was prescribed a medication that he has been taking for the past 4 days. He denies headache, fever, chills, or nausea. Past medical history is not contributory. Vital signs are temperature of 36 degrees Celsius or 98 degrees Fahrenheit, blood pressure of 122/76, pulse of 68 beats per minute, and respirations of 18 per minute. BMI is 25. Physical examination reveals conjunctival pallor. The rest of the exam is unremarkable. Lab values are as follows. Hemoglobin, 7.9, hematocrit, 24%, reticulocyte count, 5%, platelet count, 140,000, leukocyte count, 10,900. Which of the following is the next best step in management of this patient? Is it A, admit to hospital for observation? B, CT scan of the abdomen and pelvis? C, discontinue the new medication? D, emergent transfusion with packed red blood cells? Or E, prescribe broad-spectrum antibiotics? And the correct answer is C, discontinue the new medication. This patient is undergoing an acute hemolytic episode secondary to G6PD deficiency. His primary care physician most likely prescribed dapsone for newly diagnosed leprosy given his rash and sensory loss. G6PD deficiency is a genetic disorder characterized by increased vulnerability of red blood cells to oxidative injury due to decreased NADPH production. Dapsone is one of the medications that precipitates hemolysis in G6PD deficient patients. Common symptoms include anemia, jaundice, pallor, back pain, and dark urine. Discontinuation of the trigger, in this case dapsone, should resolve the episode. Answer choice A, admit to hospital for observation, is incorrect. Appropriate treatment of this case would be removal of the medication that caused the hemolytic episode. Pediatric patients with severe anemia may need to be admitted, but not this patient. Answer choice B, CT scan of the abdomen and pelvis, is incorrect. Imaging is not typically required for acute hemolytic anemia in the setting of G6PD. Answer choice D, emergent transfusion with packed red blood cells, is incorrect. Emergent transfusions are usually reserved for when the hemoglobin concentration drops below 7.0 grams per deciliter, or if patients are severely symptomatic. Answer choice E, prescribed broad-spectrum antibiotics, is incorrect. This patient would not benefit from antibiotics since the cause of the acute hemolytic episode is not infectious in nature. Key learning point. G6PD deficiency is an inherited condition in which red blood cells are more susceptible to oxidative injury. Medications such as dapsone predispose patients with this condition to acute hemolytic episodes. Question 2, Hem-Onc 5. A 14-year-old boy presents to his pediatrician for evaluation of recurrent epistaxis, which has been occurring more frequently over the last 2 years. He has no other symptoms. The patient is adopted, and his adoptive father believes the patient's biological mother had a similar condition. Physical examination reveals mucocutaneous telangiectasias on the lips and oral mucosa. Lab tests are ordered and indicate a microcytic anemia, normal platelets, and normal creatinine. Which of the following additional features is most likely present in this patient? Is it A, arthralgias, B, autoantibodies versus ADAMTS13, C, hamartomatous gastrointestinal polyps, D, pulmonary arteriovenous malformation, or E, tracheal narrowing with ulceration? And the correct answer here is D, pulmonary arteriovenous malformation. This patient likely has hereditary hemorrhagic telangiectasia, HHT, also known as Osler-Weber-Rendu syndrome. It is an autosomal dominant vascular disorder that is characterized by epistaxis, mucocutaneous telangiectasias on the lips, oral mucosa, and fingertips, and microcytic anemia due to occult bleeding in the gastrointestinal tract. Arteriovenous malformations frequently affect the pulmonary, hepatic, and cerebral circulation. Answer choice A, arthralgias, is incorrect. IgA vasculitis, formerly known as Hem-Onc purpura, occurs after an upper respiratory infection due to IgA, C3, and fibrin deposition in small vessels. It results in palpable purpura or petechiae on the lower extremities, arthritis or arthralgias, abdominal pain, often with intussusception, and renal disease. Young boys may also experience scrotal pain or swelling. Answer choice B, autoantibodies versus ADAMTS13, is incorrect. Antibodies against ADAMTS13 is a feature of thrombotic thrombocytopenic purpura, also known as TTP, which results in large von Willebrand factor multimers that activate coagulation. Renal insufficiency is expected along with microangiopathic hemolytic anemia, thrombocytopenia, neurological changes, and fever. Answer choice C, hamartomatous gastrointestinal polyps, is incorrect. This would be a feature of Peutz-Jeghers syndrome, an autosomal dominant condition. Although Peutz-Jeghers syndrome also presents with mucocutaneous macules, these are caused by hyperpigmented macrophages and are not telangiectatic as in HHT. Answer choice E, tracheal narrowing with ulceration, is incorrect. This is a feature of granulomatosis with polyangiitis, also known as GPA, which is a vasculitis affecting capillaries and small vessels. Although GPA can also present with epistaxis and may have pulmonary nodules on chest X-ray, renal involvement would be expected. Key learning point: hereditary hemorrhagic telangiectasia, HHT, typically presents with epistaxis, mucocutaneous telangiectasias, microcytic anemia due to occult bleeding, and arteriovenous malformations. A family history is expected for this autosomal dominant disorder.
Eczema is unpredictable, but you can flare less with Ebglyss, a once-monthly treatment for moderate to severe eczema. After an initial 4-month or longer dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks, and most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 mg per 2 ml injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
There's fishing. And then there's fishing. Out here, you're after dinner. Online, hackers are after your data. They'll bait you with fake emails, lookalike sites, anything to lure you in. But with Cisco Duo's end-to-end phishing-resistant access control, every login, every device, every user stays protected. Looks like no one's biting today. Cisco Duo. Phishing season is over. Learn more at duo.com.
Question 3, Hem-Onc 6. A 55-year-old man presents to the emergency department with a 10-day history of fatigue, shortness of breath, and lightheadedness with minimal exertion. He is found to have a hemoglobin concentration of 6.7 grams per deciliter. He is consented for a blood transfusion, which is started. He is admitted to the hospital for further evaluation. 3 hours after transfusion of 1 unit of packed red blood cells, he develops fever and chills. His temperature is 38.8 degrees Celsius or 101.8 degrees Fahrenheit. Blood pressure is 118/67, pulse is 112 beats per minute, and respirations are 18 per minute. On physical examination, he appears pale and has tachycardia. The remainder of the examination shows no abnormalities. His hemoglobin concentration is measured again and is 7.7 grams per deciliter. Direct Coombs test is negative. Prothrombin time, PT, activated partial thromboplastin time, APTT, fibrinogen and platelet counts are all within normal limits. Urinalysis is unremarkable. Blood cultures are drawn. Which of the following is the most likely explanation for this patient's fever? Is it A, bacterial contamination of the transfused blood, B, hemolytic transfusion reaction, C, human immunodeficiency virus infection from the transfused blood, D, IgA deficiency, or E, release of cytokines from the transfused blood? And the correct answer is E, release of cytokines from the transfused blood. Release of cytokines from the transfused blood is the most likely cause of this patient's fever following the transfusion of packed red blood cells. Transfusion reactions are common and can range in severity from mild discomfort, such as itching, fever, or mild rash, to life-threatening illness, such as hemolysis or anaphylaxis. The time course of this patient's fever, several hours after the start of the transfusion, and normal laboratory studies to evaluate for a hemolytic transfusion reaction are consistent with an acute febrile non-hemolytic transfusion reaction, FNHTR, which is the most common type of transfusion reaction. FNHTR occurs because of the presence of preformed antibodies on donor leukocyte antigens and from cytokines in the plasma component of the transfused sample. It is typically mild in severity and resolves with supportive care. If symptoms occur during the transfusion, it should be stopped immediately to rule out ABO incompatibility. Antipyretics and consideration of other causes of fever are recommended. Recurrent FNHTR can be prevented through the transfusion of leukodepleted red blood cells. Answer choice A, bacterial contamination of the transfused blood, is incorrect. Bacterial contamination of the transfused blood is uncommon, but all potential causes of fever should be evaluated. Bacterial infection is more common after the transfusion of platelets. Bacterial infection as a cause of fever would generally occur later than 2 hours after the start of the transfusion and may be accompanied by hypotension. Answer choice B, hemolytic transfusion reaction, is incorrect. Hemolytic transfusion reactions usually occur after clerical errors that result in the transfusion of ABO-incompatible blood. In these instances, preformed antibodies against antigens on the surface of donor red blood cells lead to widespread hemolysis. This reaction is typically severe and may present with fever, flank pain, hemoglobinuria, and occasionally death. This patient's laboratory results are not consistent with a hemolytic transfusion reaction. Answer choice C, HIV infection from transfused blood, is incorrect. HIV infections from transfused blood are far less common in current clinical practice because of the universal screening of donated blood. Additionally, the symptoms of HIV infection would be delayed and are unlikely to occur within 2 hours of administration of any contaminated blood products. Answer choice D, IgA deficiency, is incorrect. IgA deficiency can lead to anaphylaxis secondary to preformed antibodies against donor immunoglobulins and can be prevented by washing out as much plasma as possible from donor red blood cells. This patient does not have signs or symptoms of anaphylaxis. Key learning point. Acute febrile non-hemolytic transfusion reactions are the most common type of transfusion reaction and typically resolve with supportive care. These reactions occur as a result of preformed antibodies on leukocyte antigens and cytokines from the donor plasma. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 2 questions at medprep2go.com. Happy studying!
Business owners, game day isn't just another shift. It's your biggest opportunity. What you show on your screens decides where fans stay. EverPass brings premium live sports together in one streaming platform built for businesses, so you can deliver the games your customers want without the hassle. Reliable, easy to manage, and designed for your venue. Make your place the one fans choose. Visit everpass.com to learn more.
An employee's email signature might not seem like a big deal until audit season. Outdated legal language, missing disclaimers, unapproved edits. If signatures aren't centrally enforced, you cannot control regulatory exposure. And the more your organization grows, the more that exposure scales. Exclaimer is email signature management built for IT. One dashboard, centralized control, audit trails. Visit exclaimer.com to start your free trial.